Hello, everyone, and welcome to the 2023 NLM Virtual Symposium on Health Misinformation. We're glad you're able to join us today. I'm Sean Corning, one of the Education and Outreach Coordinators with NNLM Region 7. So before we get started, just a couple technical items to cover. So all attendees have been muted, but we welcome your questions and comments in any discussion in the Zoom chat at any time. VFairs is providing technical assistance today, so we'll be able to help if we have any problems on that end, and NLM staff will be keeping an eye on the chat with me. Be sure to select everyone from the drop-down menu when posting your comments in chat to ensure that everyone sees them. If you'd like to submit questions for the speakers, please use the Q&A function. This helps us find them and make sure that they're not lost in chat. So we have a live closed captioner for this event. You can access the closed captions by clicking on the icon with the 3 dots at the bottom of your Zoom screen and then selecting closed caption. If you would like to share on social media, we encourage you to use the hashtag for the event HealthMisinfo_NNLM. So before I get started, I'd like to share a little about who we are for those who don't know about us as well. So the National Institutes of Health is the nation's leading medical research agency. Many of you might be familiar with the National Center of Allergies and Infectious Disease, which is one of the many institutes and centers at the NIH. So the NLM, or the National Library of Medicine, is another of those 27 institutes and offices within the National Institutes of Health. It's also the world's largest biomedical library and produces online resources like PubMed and Medline Plus. NNLM, the network of the National Library of Medicine, is an outreach program of NLM, working to ensure health professionals and the public have equal access to health information. And then the NNLM itself is made up of 7 regional medical libraries, 3 national offices, and 4 national centers, all providing training, funding, and engagement opportunities like this to over 9,000 NNLM member organizations. So for this session, we've got 2 talks. So I will introduce our first speaker. We'll have that talk, and then we'll hold questions to the end, to after the second talk, and then we can have questions all at once. So it's my pleasure today to introduce Sylvia Baedorf Kassis. And she'll be talking today about the Multi-Regional Clinical Trial Center of Brigham. Oh, sorry, she's from the Multi-Regional Clinical Trial Center of Brigham and Women's Hospital and Harvard. And she's going to be talking today about a tool to promote clinical research understanding. Thank you so much for being with us today.
Thank you so much for that introduction. Let me just pull up my slides and then we'll get started. Thank you so much for inviting me and including me in this session. I felt like it was such an important topic given the last few years, and I've had the opportunity to hop in on a few of the other sessions and found them really interesting and engaging. So it's really wonderful to be included in such an esteemed group of individuals thinking and organizations thinking about how we can improve health literacy, and I think deal with some of the consequences of misinformation and disinformation. And so the thing that I will be talking about today is the Multi-Regional Clinical Trial Center's Plain Language Clinical Research Glossary. And it's a really wonderful opportunity for folks in the community settings, in libraries and other such domains, to be able to share information about research, what it is, and whether people might want to consider participating in research. So before I get into the details, I'll just say that these are my opinions and not the opinions of Brigham and Women's Hospital or Harvard University, and I have no conflicts of interest related to this presentation. I'll give you a little background about the center and then talk a little bit about health literacy and clinical research, leading into an overview of the glossary itself, the background and the process that we followed to develop it, and then a little call to action for you all if you're be so willing to engage in the exercise that I put forth. So the Multi-Regional Clinical Trial Center is a research and policy center focused on addressing conduct, oversight, ethics, and regulatory environment of clinical trials. And we have our vision to support the integrity, safety, and rigor of global clinical trials. And this is important because clinical trials are, in fact, one of the key ways that we find out information about what treatments work, what medicines, what interventions, which don't work, what populations do they work best in, and so on. And so we think about this on the global scale, but also tremendously domestically within the US in terms of our diversity, equity, and inclusion projects, pediatrics and inclusion and research initiative, and so on. But the way that we do our work is to engage diverse stakeholders from across the research ecosystem to define emerging issues and also maybe complain about the ongoing issues, figuring out what are the things that are still continuing to be issues, and try to come up with ethical, actionable, and most importantly, practical solutions so that at the end of the day, we're not just highlighting what all the problems are, but really focusing on what potential solutions could be and what people could do on the ground. So in terms of health literacy, this isn't like a new thing for us. We've been doing work in this space since before 2019. In fact, when we were doing work in the 2013 to 2017 on return of research results to participants. And this was really focused on how do we get study summaries into the hands of patients and participants who have been in studies. And health literacy, or the ability to understand information, became a huge part of that discussion. So I came on board in 2018 and helped to lead a multi-stakeholder initiative that resulted in the launch of this publicly available health literacy in clinical research website. It's a wonderful resource to point people to all the health literacy opportunities across the clinical trial life cycle. So when a person learns about research, all the way to participating in the study, to at the end of the study, what they would want to know, and how also the research stakeholders like researchers and sponsors and ethics boards can help promote that health literacy approach throughout the research. Not long after that, we of course hit the global pandemic, and we had a request from multiple health centers around the country to have some informational sort of fact sheets on COVID-19 and COVID-19 research that they could use as introductory sort of primer before they would introduce a particular detailed study and recruit someone to a study. And we had these available in English and Spanish, and they were used in multiple different settings throughout the pandemic and continue to be downloaded for conversations around research that is involving the sequelae of COVID and so on. I also spent a great deal of time developing and designing health literacy trainings for many different stakeholder audiences. We have some online ones that are available for ethics boards, specifically institutional review boards, ethics boards at academic health centers, and also commercial IRBs that might be interested in learning a bit more about health literacy and thinking about their own role in that. And we're also developing a number of different study training initiatives of like general health literacy 101 for clinical research professionals, and so on. And then I'll just say that this glossary, which I'm going to talk about, is something that we started piloting in 2020. We launched the website, its original piloted version, in 2021, and that's the link here, and the link will be throughout the slides for you to be able to pick up. And it was in these last couple of years that there's been this robust utilization, a huge appreciation for it to continue growing. And so we've continued to develop this resource and are collaborating with a wonderful partner now, CDISC, the Clinical Data Interchange Standards Consortium, which is actually an international group that will allow us to have plain language, health literate, plain language, clinical research definitions included as a standard for global clinical trials. And that counts domestically and internationally. So I've said a lot about clinical research and I've said a lot about health literacy. So I will just quickly just say that for the uninitiated, a clear, plain definition of clinical research is that it's a way to study health and illness in people, and we find out which treatments are safe and how well they work through clinical research. And health literacy itself, I've actually heard quite a few people in these sessions over the last couple of days talk about health literacy. So I think this is something in the forefront of our minds as we think about health misinformation. The original definition, or one that was common about 20 years ago or so, was that it's the degree to which people are able to obtain, process, and understand basic health info to make appropriate health decisions. And in the Healthy People 2030 initiative, and sort of in the community at large, in the community of health literacy professionals at large, the definition has really evolved to focus on two prongs now. There's still personal health literacy. So we are dealing with the fact that individuals themselves may have low health literacy, medium health literacy, or high health literacy, and that can affect their ability to understand information. But we are also focused now more on the notion of organizational health literacy in the ways in which we as communicators need to use our skill and have the responsibility to really communicate in the most effective ways. And so in the conversations and some of the sessions I went to yesterday, one of them was talking about how low health literacy levels actually increases someone's susceptibility to misinformation. So that very much aligns with our experience as well in the work we've been doing in our center. And so we really want to think about how we're going to address that in the context of clinical research. And literacy levels at large are quite low in the US. Now, this 2003 data is quite old now. It's literally 20 years old now. But what we see here and what we expect would be trending still today is that most people are really at intermediate, basic, or below basic levels of literacy. And so this suggests that 9 out of 10 people can use extra help with the information that they're getting, particularly when we start talking about complex, technical information delivered perhaps in highly novel settings, like a healthcare setting, stressful settings, and new settings for people, uncomfortable settings. These are ways that health literacy can decrease even amongst people who have proficient health literacy. We see dropping ability for people to comprehend, take in the information, and process it. And we see similar numbers in the program for the International Assessment of Adult Competencies. They do a scale where they look at literacy and numeracy, and similarly find people at level 1 or below level 2. So we're looking at 5th and 8th grade level. And these statistics also trend very similarly in Europe and in Asia as well, when there have been literacy assessments done in those locations. So what that means, thinking about health literacy and thinking about misinformation, we really wanted to create a resource that before 2020, to our knowledge, did not exist, which was a resource of consistent, accurate, and simplified clinical research definitions. And that was the need was really that we would provide harmonized definitions that could be used across the research industry to promote a unified approach that really supports patients, participants, and their caregivers to best understand the information that they're being given and make informed decisions about their participation in research. So our mission was to create this glossary with patients, participants, and caregivers at the table with us, design it for public understanding, but ensure that it was accepted by industry and academic stakeholders across the clinical research ecosystem so that we could facilitate bi-directional communication around research. And hopefully in those processes, also address issues of misinformation, malinformation, et cetera. And what we really see as the benefits of this collaboration in terms of our work with this group CDISC, which is bringing our glossary into a larger ecosystem with industry and other leaders being able to adopt a plain language clinical research glossary, we see the benefits of consistency across groups, accuracy in terms of the way that information is described, reliability of that information, transparency in terms of who's developed it, how it's developed, and I will tell you a bit about our process, and thereby leading to trustworthiness of the information. And it also, in the process, increases efficiency and interoperability. Interoperability, not just that when you use a term or a definition in your consent form, for example, you might also, you would see it consistently used then in other study materials or in the study summary results in the end, but also interoperability in terms of technical definitions, which CDISC has for all of its clinical research terminology, so very technical definitions, and its connection to a plain language option for that technical definition. So that now we're seeing also that sort of line being drawn between technical information and plain language information designed for the public, designed for people who are just trying to learn new information or be able to access information in ways that is as easy for them to understand as possible. So we piloted this glossary in 2020. We did 53 words to start and really focused on what the process would be. And we released it in 2021 with this website here and wrote a paper about it as well if you're really interested in the process that we followed. We had a work group of over almost 30 people that were involved with patients and patient advocates at the table with us working on the definitions and all the content. And I'll walk you through what a typical definition looks like. So you have a sense that it's not just a plain language sentence and that's it. We spend a lot of time on that plain language definition and focus on how to make one sentence be as clear and simple and be the entree to the clinical research kind of conversation that could follow from it. But we also include information like the auditory pronunciation guide, an image or a graphic for every word so that there's also a visual cue and increased engagement with the content, use in a sentence, more info, words that might be related to that, opposite words, and then also linking to other resources. And this commonly goes to places like FDA resources, NIH, Office of Human Research Protections, others that have done this work and might have more detailed technical information that people might want to access and look at. And I will note that in the future, this section here is actually being revisited to be able to actually change this opposite section to be more patient focused. So we intend to have a place there where folks can learn more about when they might see randomization in clinical trial, clinical research materials, and what questions they might want to ask. For example, will my study involve randomization? And if it does, what does that mean for me as a participant? And so as a reminder, our glossary is for patients, participants, caregivers, and the public. We also intend it for people who create research materials for non-technical audiences and research sponsors and researchers to be able to use a common language. So we have a goal of 150 new definitions to be added by the end of 2023. We have a wonderful work group in these expansion activities right now that is comprised of 2 work streams, a development team and a review team. And we have together over 26 members, almost 30 members again, and multi-stakeholder with patients and caregiver advocates at the table. And our review team is exclusively patient caregiver advocates who review the material before it moves through finalization. We do this work through monthly written feedback via a cloud-based method. And we also have consensus conversations every month where we get together and have conversations about these definitions and arriving at the plain language definition and additional content. So we select, define, refine, finalize, and release. And defining is really focused on that plain language, single sentence, no long sentences, short, simple words, conversational tone, and active voice whenever possible. And the refining really happens when we're in meetings together. And we really try to get out whether the content is clear, it's accurate, whether it's consistent with other similar glossary definitions and terms, plain language being used, its understandability, agreement with other authoritative definitions. In this case, we look at the technical definitions of CDISC and others, NIH, NCI, and others, and as well as the context that this would be used in, as well as any other concerns. And then we do a vote of whether we can accept this definition and always aim for 80% or above. And I don't think we only a couple of times had less than 100% agreement on words, but always over the 80% threshold. Now the CDISC public review, which is what will be an ask for you to think about, and as we depart from this in a few minutes, is an opportunity for additional review of the definitions we put forth. So you've seen we have a pretty robust process and a diverse work group of individuals who are putting forth their effort to create plain language definitions. But now we actually have an opportunity through this work with this global standards organization to open it up for public review and have users like you or others in your community take a look at those definitions and let us know, are they meeting the mark? Do they work for folks? So what I wanted to really think about with this as well is that in this process, in terms of addressing clinical research and misinformation, we know that there's very legitimate mistrust amongst groups, particularly those that have been historically minoritized, marginalized, and abused by the healthcare system and research system. And so there are concerns often about research that we're working to help to address. That's not the same as misinformation, but it's in the ecosystem, right? None of these things live alone. And so what we're trying to do is build trustworthiness in this resource because of the process that we put forth and the people that are working together to do it. And so by inviting and engaging multiple diverse perspectives and developing this resource, we're increasing the likelihood that we can address areas where there are potential, misinformation, there could be confusion, and we're helping to contribute to the sort of valid, acceptable, appropriate information that's out there to help support people understanding about research. And so as we continue to explore and grow relationships with individuals, groups, and organizations, we get new perspectives, and we also find new dissemination pathways. And I will highlight again that, with this opportunity to have plain language definitions and understandability, the idea of fluency, which also came up in Dr. Nan's presentation yesterday, is that when people find info easier to process, they find it to be more believable. And so when we create understandable information for people, we increase the likelihood of them to be able to believe it, understand it, and move forward with something that is still aligned with their values, but at least is a fully actualized decision. So the way that we see it, by having plain language explanations, using this user-centric design and layout, having tailored images and graphics, we are able to increase interest, engagement, learning, understanding, and ultimately empowerment, which in this case is, can I make a decision for myself about research that I feel good about? Can I make a decision for my loved one about research that is appropriate for them? So for folks in this audience, I understand there's librarians, public health professionals, all sorts of different folks here, researchers potentially. By using and applying this clinical research glossary, you can use it in creating informational research resources for the community, awareness campaigns you might be running. Like, for example, it's Parkinson's Awareness Month in April, or in Breast Cancer Awareness Month in October, when you're talking about healthcare and clinical trials and the way that clinical trials contribute to the knowledge we have about the treatments and the medicines and the things that we do now. You can use it in specific clinical research study materials and activities, like recruitment flyers, consent forms, study instructions, and so on. In training research staff and patient advocates or others who have to engage around clinical research. And I put it forth to you, are there other ideas? Could you envision using this glossary at something in your community, at a health fair, and other places? Can you consider using some of these words in the work that you do yourself? We had a campaign a couple of years ago for Health Literacy Month, which is also in October, where we had the glossary up on screens around our hospital healthcare system, so people could at least even see, research is being talked about in this clinical care setting. Research is a part of clinical care here. And these are things that I can access and think about before I'm, approached perhaps in the context of my care or whatever about a specific study. It's really about normalizing research as well. So 2 things you can do today, and then I will pass it back along, is you can check out the clinical research glossary. You can pass that along to your folks in your community and start to think about how it might be helpful to you. And I'll say there will be a brand new website coming towards the end of this year, which will have all 200 plus words on it and will continue to grow beyond. But you can also complete the public review and share it with your network. And we have the information here around that. And if you want more info, I can certainly send you details about that. We also have a video on our website about how to complete the comment process. So we're really trying hard to get folks who may not typically be using our resources to take a look though and see if there's anything they would change. So in summary, I'll say clinical research is an important part of medicine and healthcare, and there's misinformation around it, and we want to combat that by increasing the sources of reputable, respectable, and diversely developed materials. We have designed this glossary especially for patients, participants, and caregivers, and by providing high quality, easy to understand info that is developed by multiple stakeholders with varying perspectives, we can hopefully promote understanding and conversely address misinformation. So thank you so much for your time today, and I'll pass it along to Sean, and he'll introduce the next set of speakers. Thank you very much, everyone.
Thank you for that great presentation, Sylvia. Just as a reminder for anyone who has any questions for Sylvia, we'll be answering those at the end of this session after this next presentation. And if you have questions, make sure that you put those in the question and answer function within Zoom. So now for our second panel this session, it's my pleasure to introduce today Megan von Eisenberg, Lucy Brooks Waldrop, and Samantha Kaplan, all of Duke University. And they'll be speaking today about COVID-19 misinformation in anti-vaccination websites, a content analysis of archived websites. Thank you so much for joining us today, and I'll pass it over to them.
All right, hi, thank you so much for that warm introduction. Our presentation is going to give you a brief overview and some hidden gems from a recent paper that we published. First, I do want to introduce our research team once again, Megan von Eisenberg, the Associate Dean for Library Services and Archives at the Duke University Medical Center Library and Archives, as well as Lucy Waldrop, our Assistant Director at the Archives, and myself, I'm Sammy Kaplan, one of our research and education librarians. We are so excited to be here today and grateful for this opportunity to share some of the hidden gems from our recent paper with you. So today, first, we're going to set the stage with the historical context that we felt kind of necessitated the creation of a web archive around anti-vaccination discourse. Then Lucy is going to discuss how we capture the ephemera today, as well as a case that we found very interesting during our research that wasn't really able to make it into the manuscript. I'm going to briefly cover some of kind of the highlights of our paper, and then Megan is going to tell you about opportunities that we think exist for web archiving misinformation research. So first, just to set the stage of the historical context here, you know, we have lots of examples, usually captured more in things like advertisements or newspaper articles, diaries, but physical paper ephemera, that there has always been a discourse around vaccination. On the left, you see a very, very dynamic, very strong opinion piece about vaccinations. And on the right is a really beautiful depiction of smallpox inoculation arguing in favor of it from Harper's Weekly in 1871. And we share these just to illustrate, like, there has always been a discourse here. This is not new, particularly new or recent. It may be novel because of COVID-19, but it's not new. On the other side of that, right, we also archive things to capture progress, right? So these are some images from Duke archives around things that we used to advertise for as preventatives and medicine. And we can, by capturing these things, we can also see the progress that we have made as a scientific community. And that really led us to think about, where is this discourse today? right? Now, a lot of it has moved online. Things that, you might have seen as handouts somewhere. These are tweets, these are memes. And that started to really get us thinking, how are we keeping it in some way? And so now Lucy is going to talk to us about capturing the ephemera of today.
Thank you, Sammy. So the amount of freely accessible information on the web is absolutely staggering, but the content is fragile, impermanent, and unstable. In an era of increasing misinformation, fake news, and the politicization of science, it is essential to capture transient information on websites. In 2003, UNESCO's Charter on the Preservation of Digital Heritage recognized the importance of the preservation and future accessibility of web content because of its enduring historic value, stating that the disappearance of heritage in whatever form constitutes an impoverishment of the heritage of all nations. The importance of capturing and preserving these transient and fragile web resources goes beyond saving the content only for historical value and research, as preserving web content also supports current technology through determining the trustworthiness of statements, detecting web spam, improving web information retrieval, and forecasting events. Next slide, please. The rapidly changing landscape of the web is at the nexus of the need to preserve its content. For example, after 1 year, 80% of web pages are no longer available as they were originally published. After 27 months, 13% of web references and scholarly articles disappear. Without the resources to capture and save this web content, gaps in the historic record are inevitable. More specifically, the content captured with web archiving can be used in future research to understand misinformation and public discourse on topics. Next slide, please. Web archiving offers a way to capture and preserve selected websites to be used for future research needs and to provide context. The Internet Archive, founded in 1996, paved the way for web archiving with a mission to create a digital archive to permanently store as much of the Internet as possible through the capture and preservation of saved websites accessible through the Wayback Machine. Archivate, launched in 2006 by the Internet Archive, provides a subscription web archiving service for users called Partners. It is the leading web archiving service for collecting and accessing cultural heritage on the web. The difference between the Wayback Machine and Archivate is the Wayback Machine captures all accessible content with very limited quality control, and Archivate allows subscribers to curate their own collections of web content specific to their own institutions and collection development policies. Access is free for both, but Archivate partners pay for their subscription, which is broken into tiers based on the amount of allowable saved data. In 2017, Ivy Plus Libraries launched their web collection program for its members. The program is a collaborative collection development effort to build curated thematic collections of freely available but at-risk web content in order to support research at participating libraries and beyond. They use Archivate for their web crawler. We launched the Vaccination in Modern America, Misinformation versus Public Health Advocacy Web Archive in January 2020 with the University of Pennsylvania Libraries. Next slide, please. Since January 2020, the Vaccination in Modern America Web Archive has been crawled every 6 months. As of today, 40 pro and anti-vaccination websites, or seeds as Archivate calls them, are captured with each crawl. The current 40 websites will continue to be crawled every 6 months, and as more web content is discovered, it can be added to the collection. All of this content is publicly accessible from the collection homepage via Archivate. Next slide, please. When examining the results of our captures, we noticed that several websites disappeared or dramatically altered their content. One of these websites is the J.B. Hanley blog. Before we get into how the J.B. Hanley blog has changed over 3 years, let's learn who J.B. Hanley is. Hanley is the father of 3 children. His son, Jamie, was diagnosed with autism. He and his wife, Lisa, co-founded Generation Rescue, a nonprofit for autism recovery that very effectively organized other parents concerned about the debunked autism vaccine link. He is the author of 2 books on the topic, as well as producing with his wife the documentary film Autism Yesterday, with another film in the works. Next slide, please. The top screenshot shows the dates and amount of captures made by the crawler to the JB Handley blog. Here's where the user can select which crawl dates to view. Since February 3rd, 2020, the JB Handley blog has been crawled 7 times, with its content saved 14 times. This is because sometimes the crawler saves content multiple times during a crawl. The bottom screenshot shows the website or seed level metadata added by us. Each seed must have a complete set of metadata written before it can be made public. All of this content, once again, is available on the website that's hosted by Archivate. Next slide, please. Here is a screenshot of what the Archivate crawler captured on its first crawl on February 3rd, 2020. You can see the crawl date by looking at the yellow ribbon along the top of the page. There are 3 blog posts that were captured, and they are dated from April 2nd, 2018 to December 10th, 2018. The posts are all related to autism and are accessible from the collection page via Archivate, and users can use the archived web content the same way you would view content on the live web by selecting the item to open it to view what the blog post, the content of the blog post. Next slide, please. The blog was next crawled on September 3rd, 2020, and it captured 10 blog posts. Those posts ranged in dates from April 2nd, 2018 to August 9th, 2020. The saved web content includes those original 3 blog posts seen in the February 2020 capture. Those were all about autism. But now there are 7 newly captured blog posts that focus on COVID, lockdowns, vaccines, and schools. Next slide, please. On March 1st, 2021, the website was crawled again and captured 7 blog posts, ranging in dates from April 2nd, 2018 to October 29th, 2020. This capture includes the original 3 blog posts from the February 2020 capture about autism. Of the 7 blog posts about COVID captured during the September 2020 crawl, only 3 blog posts are still available. The other 4 blog posts were deleted. There is 1 new blog post that was posted on October 29th, 2020. Are vaccines really safe and effective? Next slide, please. The final capture to be reviewed is from September 1st, 2021. Only 2 blog posts were available to be captured by Archivate's crawler. The dates of those blog posts are December 10th, 2018 and March 17th, 2021. Both blog posts are about autism. Next slide, please. The live website on April 3rd, 2023 shows 4 blog posts with dates from 2018, 2021, 2022, and 2023. The newest one is on the left. The post from 2018 was captured with each crawl we discussed. The 2021 post appeared in the results of the September 2021 crawl. The posts added in September 2022 and March 2023 are related to Handley's new documentary Spellers, about a communication method, spelling to communicate, used by his son Jamie. All posts are about autism. Next slide, please. What happened to make Handley delete the bulk of his blog posts that were captured from February 2020 to March 2021? Next slide, please. I'm not a mind reader, so I do not know how Handley would answer, but he published a book, Underestimated, an Autism Miracle, on March 23rd, 2021.
Thank you, Lucy. So now I'm going to give you a brief overview of the manuscript that we recently published in the study where we kind of uncovered some of these things. So at the time that we undertook our study, the archive had about 25 anti-vaccination sites. We decided to do a content analysis that was a 2-pronged study. We wanted to assess pre-pandemic anti-vax sites' COVID behavior, and we also wanted to test the viability of the web archive for research. Our coding schema was informed by existing anti-vax research. The codebook is available with manuscript. Websites were assessed across broad categories, including COVID-19 vaccines, specifically whether they mention them or the brand name, personal freedom concerns like masking, bodily integrity, and stay-at-home orders, safety concerns like the compromised research process, and inclusion of specific ingredients. There was also a category around distrust of science and institutions like financial motivations, corruption, etc. We did our analysis in December of 2021 to January 2022. We used archived and live sites. We had initially intended to only use the archived sites, but they were not robust enough, and we'll discuss that a bit later. This is kind of the broad summary of our findings, which was that, interesting to us, more than half of the included sites solicited donations, and about half mentioned their tax status. We didn't collect tax status, but sites largely purported to be nonprofits. In addition to collecting donations, almost 3/4 of sites had a membership option of some kind. 2/3 of the sites addressed COVID-19 vaccines in some way, and more than 1/3 mentioned at least one COVID-19 vaccine, with Moderna being the most commonly mentioned, closely followed by Pfizer. 2/3 of sites referenced some element of personal freedom, and 60% referenced skepticism of science and conspiracy concerns, with half referencing safety concerns. And again, these are just sort of the broad findings, the heavy hits from our paper, but I invite you to explore the full manuscript recently published in JMIR Formative Research. But we learned a lot, particularly about the use of web archives for misinformation research. And with that, I will pass it to Megan.
Thank you, Sammy and Lucy. As Sammy said, in addition to the results of our content analysis, we also want to share some observations on how easy or challenging it is to use web archives like the anti-vaccination collection for misinformation research. As we mentioned earlier, the primary goal of the collection was to enable research on these ephemeral web pages. And so one result was kind of like how well that process will actually work. So what works? As Lucy's story about J.B. Hanley illustrated, an archived website can serve as a path to some greater understanding. It can function like a series of breadcrumbs that researchers can follow to learn more about the content on the website, which is helpful whether you're trying to understand the author and their activities, or whether you're trying to learn from the content itself. An archived website also captures a whole lot of the content on the site, primarily the text. The general layout of pages on the site, and like the site menus and other organizational outlines of what is contained on the website. So you've got this snapshot of what the site had. Next slide, please. Sadly, though, not all content and features on an archived site will work in the same way as they do on the live site. An archived web page functions much like a collection of documents. Many features of modern websites exceed that kind of collection of documents framework and may not work, like graphics and videos that are embedded on the web page but hosted elsewhere. And links to other sites will appear, but will not correctly link out to a version of that other site from the archive date and time unless it happened to be crawled by your team as well. To complete our content analysis, we tried using that search function on the archived websites very heavily, but these did not always work. And when they did, they worked very slowly. And it was often more reliable to click through pages and just manually read rather than relying on the search. Many of the sites in our anti-vaccination web collection used features that evade web archive crawlers, such as putting premium content behind a paywall or in newsletters or social media, where the web crawler could not get to it. And these led to gaps in our ability to review all the content. So it's not clear that the website creators are using these tactics specifically to avoid Archivate and other web crawlers, or whether they're just common tactics that are really being implemented across websites in general for building communities for advocacy, as well as for fundraising or other purposes. Next slide, please. So as we reflect on our challenges in using the web archive that we helped construct, we're concerned that several tactics of websites effectively evade capture for present and future researchers. On one website, we observed the use of content that expires, meaning the content is designed to disappear from the site after a certain period of time. Again, it's unclear if this is in response to web archiving or to recent moves to scrub one's web and social media history of any potentially problematic content that could be related to book sales or political ambitions or other changes. Not only is this expiring content at risk of not being captured, but it also stokes fear and feeds partisan othering among readers. We also saw many sites adopt indicators of quality that teachers, librarians, web administrators, and others have encouraged as markers of trustworthiness, such as seals of approval like Charity Navigator. Some sites have moved to different platforms and include new newsletter models like Substack, and these changes in URLs and format can break captured links, diminish the functionality of an archived web page, and lead to large gaps in the captured content. And finally, as I mentioned earlier, some of those strategies that avoid capture, like premium and newsletter, just make it hard for web crawlers to keep up with the content. Next slide, please. So as an illustration, I want to briefly step through some screenshots we captured from Dr. Joseph Merkela's website. When the Web Archive first launched, the site was healthliberty.com. Since the initial captures, the site relaunched as Dr. Merkela's Natural Health site, which positions Dr. Merkela as a humble, truth-telling outsider who advertises his own credentials of expertise, which is a DO degree, while taking aim at established systems of expertise. It also sells nutritional supplements. So not only is the site at a new URL, it also has a refreshed and modern design. Part of the way through our analysis, it developed something else, a pop-up that encourages signing up for a newsletter, the content of which we noted is hard to capture, with a lot of language that frankly stokes panic about expiring articles. When you click on one of the expiring articles, you're taken to his censored library, more strong language and graphics that create fear and an us versus them mentality. So let's look closely at one recent article as an example before we wrap up. Okay, next slide, please. So just below the title, we see the phrase fact-checked with a check mark. This is an example of the kind of seal of approval or mark of authenticity that these websites with misinformation have begun to adopt. No information is provided about the fact-checking process or the fact-checkers themselves. The mark just stands there on its own. The article itself summarizes a video from another member of the anti-COVID vaccine community. The video is hosted on YouTube and will not be archived by the crawler. The story at a glance provides a vague mention to recently published research study, language that often signals trustworthiness and some grounding in science, though which is used for other purposes here. Next slide, please. Scrolling down, a graphic encourages readers to download the article before it disappears, heightening urgency, fear, and the sense of persecution by others. The article also contains links to content that's hidden, not able to be captured, and likely from similarly minded community members. The article also appropriates structures from legitimate journalism, such as a call-out quote that spotlights a sentence that reads like a fact, but is actually just a quote from another newsletter. Headers that make strong suggestions that may not be substantiated in the text below. And not called out here, but worth a quick quote. If you look at the bottom and in the Substack where the numbers paragraph, you will see reliance on the structures of expertise, quoting somebody who's a mathematician and a computer scientist or a statistics professor. With that, these add an air of legitimacy, even though the source of any expertise is opaque and perhaps irrelevant to COVID. Next slide. These are long articles, sorry. Towards the end of the article, common misinformation tactics are on display, including referencing ulterior motives of others, in this case, pharmaceutical company profit motives, while at the same time pushing Dr. Merkela's own book sales. All right, last slide, and then we're happy to participate in questions. So there are both opportunities and limits to web archiving in general, and to archive it in particular. And we hope that sharing our results and observations here and in our article will help spur other researchers to use web archives for misinformation or other kinds of research. But there's a big caveat. We also hope to spur development on web archiving tools, because these are needed to capture interconnected information, social media, paywalled and subscription content, search and embedded video and graphical content. And without enhancements in web archiving tools, a lot of information on that ephemeral web will continue to stay lost. And that wraps us up. Thank you very much. We have our list of references and our link to our article.
Okay, thank you so much for your presentation. We can move on to questions now from both the reference to both this presentation as well as Sylvia's previous presentation. So we've one question, which I think you probably have answered, but I'm not sure if you want to expand on it more. And this is, how well does this work, or is this technically allowable for Facebook pages or Twitter accounts?
So if I understand correctly, so IV Plus does the web crawling for all the Ivy Plus web collection programs. I use Archivate as part of my job at the Duke Medical Center archives to crawl Duke content. And I do not crawl social media. You can. It uses a lot of data. And since your subscription level is based on how much data you have, a lot of people don't want to eat into their data to capture that content, as well as it is notoriously difficult to capture. The crawler that they use is constantly chasing technology. So you might be able to capture something. There might be some updates to the code, and then you have a failed crawl. There are other, and I'm not as familiar, there are other web crawlers out there and ones that I believe are more suited for social media, but right now Ivy Plus is not crawling social media.
Thank you, that's helpful. And then this is a question for Sylvia. You already answered it in writing, but it's better captured by the recording if it's answered verbally. So this was question of, do you or CDISC plan to use public domain or Creative Commons license for the glossary entries?
Yes, so it is the glossary content, the written content on our glossary is completely within our Creative Commons license, so it can be used and shared and all that. And I just put a note in my response that the graphics that we have right now are not part of that, because we created many of them using other programs and services and iStock and such. So those are of a limited license in that it can be used as part of the glossary. If you're sharing the glossary with folks, certainly you can take it, but you can't just like all the things, unless it's a Creative Commons open source, you can't just take a screen grab of that picture or whatever and use it in your own materials. But we hope that will change. We are working towards creating perhaps a new set of images that are all self-generated with illustrators and graphic designers ourselves. So also, if you are folks who are so minded, graphically minded, or into the crowdsourcing images and stuff that would be open source, that would be amazing. We're trying to pilot the idea of an open source image library that accompanies the definitions, so that we have that continued sharing and learning and open use. So I'm definitely open to it and want to do it. But certainly the content you have, use it, credit the content we have there, like the written content, use it, credit it, but go forth and share it widely.
Well, thank you for that answer. I have just I have a question for you, Sylvia. So I love kind of the project of building this glossary of plain language definitions, because when I teach about health literacy and health communication, I talk a lot about plain language. Have you seen, do you have any examples of folks kind of using this in practice, perhaps practitioners incorporating this into educational materials or anything like that, or anything that you want to highlight?
Well, I think the amazing thing is that, we have just 53 words right now. So it's certainly not an extensive, exhaustive glossary, but in the time of December to February, we did some web analytics and had like over 1,600 users on the website of 53 definitions, like on different pages, lingering, taking, and going through the site. So I know it's being used. Where I know that people are using it, they're considering it, especially in electronic communications around research. So like e-consent forms, electronic documents where you can link, because you can certainly just like hyperlink things, where we think that's a great way of using it. We have it on our hospital systems rally website, which is all about patient recruitment, participant recruitment into studies. So it's there as a resource. So it's being sort of embedded into different systems and processes. And this will continue to grow. The whole purpose of CDISC and the standards that they have is that they are, they have like downloadable standards of terminology across diseases and everything. I mean, this clinical research glossary and our little piece is a tiny part of all the terminology and standards they have around data standardization. And so the point being that people will be able to sort of download this into their own systems, their own internal glossaries, and have it as an option. And I'll just also sort of point to the fact that we're working with Microsoft as well to create a plugin that will be on the web for using the glossary to define terms on the websites that are clinical research words, and also just can increase functionality around having this glossary be embeddable in a variety of places. But what we hear is that people are using it even just as a source to explain things in documents. And it's great even for research coordinators or others who are just learning about particular studies to be able to have a place to refer to answer questions and use. So there's lots of different potential uses. And it's been wonderful to see how they've been used thus far. And I would love to hear how people use them. So you can always reach out to us on our website. We have a contact us, and I'd love case studies and the like. So that was a much longer answer probably than you hoped for, but I am very excited for people to use it and to hear how people use it. And it has a lot of potential.
Thank you so much. Yeah, it is a really exciting project. So this next question's for the Duke team. What happens to collections if you switch from Archive It, or if your institution stops becoming a subscriber?
The crawls are saved on work files, which I think I'm saying correctly, WARC. That's a file format. And anyone who is a subscriber, those are your files. You don't necessarily want them unless you have the space to maintain them and migrate them. But the Internet Archive will maintain them for you. And it's my understanding that they will maintain them for you even if you are no longer a subscriber. But they also follow the locks method of lots of copies, keep stuff safe. So they have them in different geographic locations as well. So if you really want the files yourself, you can take them. There's like some interoperability with other web crawling. Conifer is one where you can use Conifer. I think it used to be called Web Recorder. I might have that reversed, where you can use Conifer to capture some content you can't use Archivit for. Then you can save that work file and upload it to your Archivit account. So then it shows up in the crawled seeds that are available for people to use.
That's helpful, thanks. And I think we've got one last question, also for the Duke team. Are there any archiving products that can capture podcasts?
That I couldn't tell you off the bat. It can capture video. It depends on the platform. Like right now I can capture YouTube, but I can't capture Vimeo. It's just the way the videos are segmented on Vimeo. It's like a 10-second segment that's like stitched into one whole video. If the podcast is yours, like my recommendation just as an archivist, or if you know the creator, is to get the creator to give you the original files. And if you can get the actual audio files, I'm not sure what those would be, if it'd be like a WAV file or an MP4 file, then you could have the files and you can save those files and ingest them into some kind of content management system where you can maintain them.
Okay, excellent. That brings us to, I think, the end of our time today. So I'm going to wrap up the Q&A. Thank you to all of our great presenters. These are some really interesting talks, and thanks to all of our audience members who came to the talks. We really value your attendance. So just a few items before we end the session. If you're interested in claiming CE credit for this session, you'll receive an email after the symposium ends with a questionnaire and instructions to claim CE. We're going to go on a 30-minute break. So the next session is going to be at 4:30 p.m. Eastern time. We encourage you to take advantage of that break, stretch, get away from the computer, and then return fresh for the last session of the day. And thank you again to all of our panelists, and we hope you have a great day.